My name is John Horowitz. I am 60 years old, and in March of 2017, I was involved in a high-speed motor vehicle accident. And although I did not fit the classic criteria for a concussion, it seems that that was the moment where I sustained a mild traumatic brain injury. So at the time, I didn't really have a tremendous number of symptoms, but gradually over the next 3 to 6 months, I began experiencing some lightheadedness, a little bit of balance disorder, and problems walking in a straight line. I went through a number of physicians to work up what the cause of this was, because I really didn't attribute it at that time to the traumatic brain injury. And everything was negative. I went to neurologists, ear, nose, and throat, because maybe it was my inner ear, and nothing came up with a source of a balance and gait problem. But after I would do my surgical procedures under magnification, and I would get up from the table to walk away and take the magnification off, I was very unstable. I had to hold on to people that were in the room. I had to grab onto the table just to make sure that I didn't fall. It's just really, for me, existing, walking down the street or getting up, walking around the house, was so taxing that I became not a very happy person. I was a little miserable. It was very hard to be around me, and was very taxing on my family life. As soon as I came into the center, I was very, very impressed. The center was extremely professional. Everyone that treated me here at the center was meticulous in their care, and very directed towards my problem. And so very quickly, when I got here, I felt, oh yeah, this is the place that's going to help me. You know, they assessed me and thought that I'd be a good candidate for the PoNS treatment. One of the things that I noticed was because I was so dysfunctional for probably almost 2 years, I had stopped doing a lot of things. And so I became debilitated. I became less able to be physically active. Something happened with using the PoNS that allowed my balance and gait to normalize. And once that happened, I was able to fully engage in the balance, the physio part of the program, and the balance and the gait training and the motor control. I think without the PoNS, there's no way that I would have been able to do that training. I was so much better that when I went back home and was walking through the airport, my wife picked me up. She's like, she had never seen me walk like that in a long time, maybe 2 to 3 years. I feel like the program has been a gift, and I don't want to forget what I was like when I first came in, so it's good for me to remember. I think that it's still an ongoing process. I feel normal in almost every way. My gait and my balance is almost completely normal. In almost every regard, the program's been a gift.